This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach.
Hello, everybody. Happy Friday. It is Pharmacist Friday, friends, and welcome back to Daily with Doc and Becca, where we bring truth, hope, and practical health education you can actually use. My name is Becca Dukes. As the host of this program, I'm also a certified holistic health coach, certified naturopathic practitioner, and the Director of Student Services for the Institute of Holistic Health. And I am super excited to be able to offer this resource to an amazing community, which includes you. So other people in that community are certified holistic health coaches, health practitioners, even medical practitioners. That I guess health and medical, they can go hand in hand. But folks, if somebody referred you to this program, make sure that you get back to them because they took the time and cared enough about you. Return the favor and say thank you. They are also going to be your number one contact if you have any additional information about anything heard on this program. Now, if you found this program on your own, we do have a team of certified holistic health coaches standing by to take your call and answer your questions. 855-949-3377. Again, 855-949-3377. Again, that's for people who have found this program all on their own and they are not already working with somebody on their health and wellness from a longevity distributor or coach. So today, folks, if you're here live with us, you want to make sure you have that chat open as our amazing co-hosts are putting information in there to help you with your notes. If you're out on any of the different platforms, make sure you like us and subscribe and comment if comments are allowed. And if you have questions, put your question in there. Now, if you have questions you don't want to chat in the public, you can always email us at questions@dailywithdoc.com. Again, questions with an S at dailywithdoc.com. Now, folks, today we are joined by our trusted friend, educator, straight talking expert, Pharmacist Ben, who has helped us cut through the noise and get to the why behind our health. And today's topic, hydration. Not just drinking water, but how hydration truly works inside the body. So folks, you've been walking around exhausted, inflamed, foggy, muscle cramping, struggling with blood pressure, digestion, energy. You do not want to miss what is going to be shared today in this program. So folks, help me welcome to the screen my friend and the one and only Pharmacist Ben Fuchs. Hello, Pharmacist Ben. Welcome. It's Friday.
I'm so excited. Pharmacist Friday. And by the way, I have to tell you, everybody impressed my friend Jill. She goes by Goddess Jill, by the way.
Goddess Jill. We loved
That's
her.
she said she was totally amazed. She gave special props to AJ. She couldn't believe how handsome AJ was, by the way. And then also Phyllis and Albert and Marilyn and Becca. She was raving about you guys. I don't know what happened.
Well, we had a great show, Pharmacist Ben, and I'm
Yeah.
excited because she's going to be coming back. She
She
will
said
actually be back with us, not next Thursday or Wednesday, but the
Wednesdays.
Wednesday after.
Yep, she said, and
Yeah.
she's super stoked. So whatever happened, whatever I didn't get to see it, but it must have been spectacular. She couldn't stop
It
raving.
was really good. We got some great feedback from our listeners. Oh, and she's on right now.
She is?
Says, very much enjoyed my time with you all.
Oh my
Yes,
gosh, she's on right
here in
now?
the Zoom with us. She's
Wow.
on.
Right.
So she said she doesn't like to miss Pharmacist Fridays
Oh,
because you always have so many gems to share.
Oh, did she really say that?
She did.
Okay, good. All
She
right.
may
Well,
not have used the word gems, but yes, she did.
all right. Well, we got some gems today about dehydration.
Yes. You know, but I know
gonna say-
there's people that don't like to drink water, or
Yeah, I
they
hear
only
that.
like to drink certain things. Sometimes people don't like to drink much at all because they don't want to have to go pee when it's inconvenient. What?
Yeah, that's interesting because I always think of people, sometimes people say they're really hungry, and you give them, you offer them something and they say, oh, no, I don't want that. Or they're really hungry. They go to a restaurant, they're looking at the menu and they can't decide what they want. They're not really hungry. If you're really hungry, you'll eat whatever's in front of you, right? And it's the same thing with thirst. You're not really thirsty. If you say, and I hear this all the time. My mom says it all the time. I don't like the taste of water, right? So, how can you not like the taste of water? It doesn't have a taste. Does it?
I know.
So
Not
I don't
really.
understand
Well,
how you don't like the
it
taste of water.
could.
What you mean is you'd rather have something that has flavor or sweetness to it. No, you don't like the water. It's like it's just not as attractive or as appealing as something with sweetness or with flavor. But you can't not like the taste of water, particularly if you're thirsty. Can you imagine somebody in the desert who's starving, who's dehydrated, and you give them some water and say, no, I don't like the taste of it? Never happened.
Well, okay, so you got city water, which depending on where you're at, tastes
Big
a lot
problem.
like chlorine.
Yeah, no, that's a
That's
big problem. That's not water, though. The water, you're not tasting the water. You're tasting the chlorine, or you're tasting the fluoride, or you're tasting whatever particulate matter. And there's some places where there's literally particulate matter in the water. So that's not the water, though. You say I don't like the taste of water. Water is just water. And by the way, that's why I drink distilled water, even though I know there's some knocks on distilled water, but it's clean. And there's a lot of mythology around distilled water. In the laboratory, we use distilled water. When I need to have non-reactivity, I use distilled water. Probably spring water, if you can get fresh spring water, which you never know, is probably better. But as far as cleanliness goes, distilled water is the cleanest. And if you ever tasted it, it doesn't have a taste.
If you get, yeah, but if you're raised in city water and you don't know any other flavor for water,
right? That's right. If you drink distilled water and then all of a sudden you drink city water, tap water, you can definitely tell the difference.
Oh yeah.
Quickly.
Oh, yeah. So when it comes to water and anything that's hydrating,
yes.
What if you do? I mean, I have some clients that, like I said, they don't want to have to go pee when it's inconvenient. They're having kidney problems. They're having blood sugar problems. They've got muscle cramping. One has some blood pressure problems.
So they don't want to. Are you saying they don't?
Bones.
Those people don't want to drink water?
These are people that don't like to drink water.
Well,
or anything for that matter.
So what is that? Is there a question attached to that? If you don't want to drink water, then don't drink water. I'm not telling anybody to drink water. It's silly.
Okay, so but if they're not drinking anything, how is that affecting their body as a whole?
Lots of different ways. First of all the tissues in your body depend on a certain amount of hydration, the connective tissues, right? So without water, they're going to contract. That's going to be perceived as pain. And there's a lot of times pain particularly joint pain and cartilage pain, connective tissue pain, can be alleviated by drinking water, and it can be caused by dehydration. As the tissue desiccates or dries, it can contract. So for one thing, there's analgesic properties to water that can have pain relieving effects for the connective tissue. And that's really important for people who are dealing with back pain, joint pain, arthritis, that kind of thing, right?
Mhm.
And that's the tissues. That's not a chemical effect. Secondly, water is filling. So a lot of times, first of all, when you're eating, if you're drinking water, you're going to eat less food. And a lot of times when we're hungry, we think when we're thirsty, we think we're hungry. And you can check this out yourself. If you really feel, if you feel like you need to eat food in the middle of the day, for example, try drinking a lot of water, 32 ounces of water, 16 ounces of water, and see what happens. A lot of times that'll fill you up. And a lot of times the drop in energy that triggers the sensation of hunger or the feeling of hunger can be alleviated by drinking water. That's the second thing. There's so many ways that water's involved with health. Then there's the whole blood issue. Water dilutes the blood, particularly first thing in the morning. First thing in the morning, the blood is thicker than it usually is because you've lost water during the day or during the night. You've slept for 6 to 8 hours. You've sweat, so you lost water. You've gone to the bathroom once or twice, so you've lost water, and you haven't drank anything for 6 to 8 hours. So the blood tends to be thicker in the morning. Blood sugar tends to be concentrated in the morning, as any diabetic will tell you. If they're testing their blood sugar in the morning, they'll tell you my blood sugar is higher. Blood sugar concentration is higher. When we say blood sugar, we mean blood sugar concentration. So how concentrated the sugar is in the blood, the less water is in the blood, the more concentrated the sugar. So two things. First of all, the first thing in the morning, drinking water will dilute the blood. You'll get better circulation to your brain, and you may get more energy first thing in the morning. Secondly, you'll eat less food first thing in the morning, like less breakfast, because you'll have more energy and you'll also be filled. You might even drink less caffeine or less coffee in the morning. And then lastly, the dilution of the blood will lower blood sugar concentration, which is helpful for people who are dealing with blood sugar issues. Then there is the digestive effects. A lot of times you'll hear people say, don't drink water with your meals, right? Have you heard people say that? Not true. You do want to drink water with your meals unless you're eating food that contains water. You need to have liquid in your belly in order for food to be digested, because the acids and the enzymes have to saturate the food. The acid and the enzymes have to be liquefied. So if you're eating like most people, meat and breads and foods that don't have a lot of water in them, drinking water will help you digest your foods more effectively. Food has to be turned into chyme in the stomach, and that's basically like a soup. So you have to have water either from food, or if you're not getting it from food, from something that you're drinking. Most importantly, perhaps, is that the chemistry of the bodies, we're chemical beings. We depend on chemistry and on chemical reactions. The chemical reactions in the body depend on water. Without water, chemistry does not work as effectively, particularly enzyme chemistry. Water is an activating substance. I think we talked about this maybe I talked about it on Monday. If you take flour, for example, and leave it on your counter, that flour will last forever until what? Until it's wet, until it has water. We all know that when water contacts dry material, that dry material starts to break down because the water activates chemistry. In the body, that activation of chemistry by water give you more energy. It'll make all the chemical reactions in your body work more efficiently, more effectively. So water is important for the chemistry of the body. In addition to pain, in addition to diluting the blood, in addition to lowering blood sugar, in addition to improving digestion, it's also, maybe its most important role is to activate chemistry. And then there is the whole aspect when it comes to water of urinating. When you drink more water, you urinate, but you don't just urinate water, you urinate B vitamins and vitamin C and electrolytes, and all the things that are in the water will come out in your urine, which means the more water you drink, the more water-soluble nutrients you're going to need. And that's why this stuff is so amazing. You see it? Yeah, there you go. This stuff is so amazing.
Cool.
That's what this does. What Beyond Tangy Tangerine does is it replaces those those water-soluble nutrients that you're going to urinate out when you drink water. So there's a lot of aspects to water that don't get recognized, such as pain relief, brain energy, neurotransmitters. I forgot to mention neurotransmitters work more effectively when there's enough water, when the body's hydrated. One of the really interesting things about water, however, is that water in the body is not necessarily the same as the water that you're drinking. And on this program is one of the few places you're going to hear us talk about this very important special kind of water. Have you heard, Rebecca, oh, you have dry skin, drink more water? Have you heard that? People say that?
Oh yeah.
And
Oh,
have you
yeah.
ever
I've
have
heard
you
it
ever heard
personally.
have you ever heard anybody say, you know, I used to have dry skin, but then I started drinking water and my dry skin just disappeared? How many times have you heard people
Haven't
say
heard
that?
that one.
Never heard that. It never happened, but you still hear people say, drink more water. And that's true if you're in the desert and you're majorly dehydrated to the point of death. It might start to show up on your skin and your lips. But for most people, that's not the case. The kind of water that keeps your skin hydrated, the kind of water really that makes the body function effectively, and not just the body in terms of the tissues, but also the cells, is a special kind of water called structured water. Structured water. Sometimes people say easy water, exclusion zone water, crystalline water. There's various names for it, but structured water is a good term because it tells you exactly what it is. It's water that's organized, coherent. Remember we talked about coherence, and we were saying how at the beginning of an orchestra, all the music is incoherent. We all know what that sounds like, but then all of a sudden they're all tuned up, right? And then all of a sudden they're all tuned up, and then all of a sudden they make most beautiful music. That's coherency. Coherency makes beautiful music. Water in the body is coherent. It makes beautiful music in the body. As we age, our water decoheres, becomes less coherent. And that's what accounts for many of the signs of aging, the visible signs of aging, as well as the deterioration inside the body, which is the end result of decoherence. In the next 20, 30, 40, 50 years, we're going to start to regard disease and aging as a decoherence, as a phenomenon that involves a coherent, beautiful music being turned into decoherent cacophony. That's what really aging and disease are. So keeping the water organized and structured is really important. Now, there's a couple things you can do. First of all, you can drink water that's organized and structured, and research shows that animals that are given structured water grow faster and grow healthier. So how do you drink organized water, structured water? Well, there's a lot of different ways. Vegetables and fruits are naturally, the water in vegetables and fruits are naturally structured. So if you drink vegetable juices or eat vegetables and fruits, you'll be ingesting structured water. If you're going to juice, you got to drink the juice quickly, though. You can't let it sit, because as the water is sitting on the counter, it loses its structure, which you can observe actually as a separation in the of the solid and the solid material and the liquid material in the juice. If you're going to get your structured water by juicing, which is a good idea, drink it fresh. Don't let it sit around, and don't leave it in the fridge for later. This stuff right here organizes water and structures water, particularly when it's mixed. Now, it'll probably have some structuring effects. The minerals in the Beyond Tangy Tangerine, that's what's doing the structuring. The minerals in the Beyond Tangy Tangerine will structure the water by stirring, but if you really want to get some good structuring effects, vortex it in a blender. So when you vortex ions, electrically charged particles, in liquid, the water structures around those particles. So it's a good idea to use a blender or some kind of what they call it, a NutriBullet or something along those lines when you do your Beyond Tangy Tangerine. Even if you feel like you don't need to and you can just stir right in, you'll get more structuring effects. I should tell you that structured water has a very interesting property. The reason why it's structured, the benefit in the body to structured water is structured water conducts energy more effectively. When the energy passes through water, it kind of disperses. And you can see this if you throw a rock into a lake, you'll get waves that are strongest right where you threw the rock, and then they kind of disperse out. As the waves spread out in the water, they get weaker and weaker and weaker until they disappear. Structured water holds on to those waves. You can think of those waves as information. And information disperses when water's not structured, but when it's structured, the information stays coherent. The water transmits the information much more effectively. So structuring water in the body allows information to go from point A to point B much more effectively than if the water's not structured. And as I said, as we age, we lose our structure, and that's one of the things that happens as we age. Our cell-to-cell communication doesn't occur as effectively because our water's breaking down. In addition to blobification, where the water breaks down, we also lose the ability to conduct information from point A to point B effectively. So structuring water in the body becomes really important. As I say, you can drink structured water and that'll support your structuring. But the best way to keep your water structured inside the body is to make sure that the structuring elements are intact or at least present. What are those structuring elements? Well, there's three main structuring elements. Collagen is a structuring element. And this is one of the reasons why building collagen has anti-aging properties. Aside from the fact that the collagen is supportive, it also helps organize water. The water molecules around collagen molecules is structured. It's coherent. Plant-derived minerals, or ionic minerals, we'll say, also have a structuring effect. It's one of the main reasons why you want to consistently be intaking ionic minerals. And then third of all, polysaccharides and what they call glycosaminoglycans, like the most famous one, which is called hyaluronic acid. Fucoidin also will help structure water. So between glycosaminoglycans and polysaccharides and proteoglycans, which are the goo of the connective tissue, and collagen, which is the rebar of the connective tissue, the solid material of the connective tissue, and the minerals, you have the main structuring elements inside the body. Water inside the body is also structured along membranes. Wherever you have membranes, you have the water around the membrane is going to be structured. And keeping membranes healthy and intact is also going to be important. Membranes are largely composed of fats. And so making sure you're getting enough fats, essential fatty acids. This is one of the benefits of supplementing with essential fatty acids. It'll support membrane health, which in turn will support structuring of water. So there's water and there's water. Just because you're drinking water doesn't mean you're getting water structure. Water has to be structured by proteins and ions and polysaccharides or proteoglycans, as they say, the goo of connective tissue, as well as being structured around membranes. Drinking water is important for anything that has to do with the blood, which of course means the entire body, because as goes the blood, so goes the body. And when I say dirty blood, what I'm really talking about is sticky, sludgy, coagulated blood. Diluting the blood with water can improve blood flow. And then the tissues themselves, particularly the cartilage and the joints, will swell in contact with water. So water can have pain relieving properties. Water can be filling and satisfying, can help improve your digestion, and it can improve neurotransmitter and enzymatic health as well, because all of that depends, the health of the hormones, the neurotransmitters, and the enzymes depend on a watery milieu. So drinking water is incredibly, incredibly important. You may not know that you're dehydrated because thirst is not necessarily the only representation of the dehydrated state. So you can't just go by your thirst, which is why it's a great idea to just drink water throughout the day, making sure you have a little Beyond Tangy Tangerine, at least sometimes to compensate for the vitamin C and the B complex and the minerals or ions that you're going to lose when you urinate. And then if you have dry skin, it's not a function of water, it's a function of structured water. So making sure the best thing you could do if you have dry skin is to help the body or the skin structure the water by using things like retinol, topical vitamin C, exfoliation techniques to stimulate the production of collagen. And also, it's a good idea to make sure that you're building collagen with your Healthy Bone and Joint Pack or the Pig Pack and all your collagen building supplements, all of Longevity's collagen building supplements. Let's see if there's anything else I want to say. Something else, but I don't remember. Oh, diluting blood sugar also. Diabetics should be drinking more water. If you don't like the taste of water, which, as we talked about earlier, I have heard, although I don't quite understand it, get some lemon juice and squeeze it in the water. There's nobody who doesn't like lemon water or cucumber water. In fact, vegetable water, you ever seen the hotels where they slice up cucumbers or oranges or, strawberries and put it in water? That's a great way to support water structuring and to get nutrients, nutritional value into the water. Your dry skin is not a function of not enough water. It can be a function of not enough structured water, but more often than not, it's a barrier issue. Although I will say, we don't know when we have dry skin. Nobody knows that they have dry skin. And quick digression, this isn't exactly what we're talking about, but it's kind of interesting. The reason why we all use moisturizers, which I'll be very clear is the dumbest thing you could ever put on your skin, the reason we do is because we don't know when we have dry skin. We only know when we have rough skin. And in our brains, roughness is collapsed with dryness. Why is that important? Well, it's important because you can soften the skin with a moisturizer, but you can't hydrate it. Even though you'll hear that word tossed around a lot about products that hydrate. Products don't hydrate. Products soften. And because we confuse dryness with roughness, we assume that when we soften, we've changed the dry condition. That's not the case. The problem there is your skin has to have a certain amount of moisture in it so that the enzymes can work effectively. The enzymes don't work effectively, you're more susceptible to skin aging, you're more susceptible to skin diseases, and you're more susceptible to skin cancer. And moisturizers are not going to change the water milieu of the skin, maybe slightly by trapping water, but very, very little. Even worse, occlusion, which means covering up the skin with a so-called moisturizer, well, while it may soften rough skin, is going to suppress skin chemistry. And that's going to ultimately make your skin drier, which is called getting addicted to your moisturizing lotion, which happens to almost everybody. And then the last interesting thing about the skin, I'm partial to the skin, as you know. The last interesting thing about the skin is there's actually little sponges in your dead skin cells on the surface. The surface of the skin is made up of dead skin cells. They're called corneocytes. Corneo means hard. Cyte means cell. They're hard cells. And these corneocytes actually have little molecular sponges inside them. And these molecular sponges are hygroscopic, H-Y-G-R-O. Hygroscopic or hygroscopicity refers to water absorption. So flour is hygroscopic in the sense that if you leave it out on the counter, it'll absorb water from the air. A steel bar is not hygroscopic. It's not going to absorb water from the air. So certain materials are hygroscopic, certain molecules, I should say, are hygroscopic, other ones aren't. Well, there are molecules in your corneocytes that are hygroscopic in the surface dead cells. And even though those cells are dead, they're functional in the sense that these molecular sponges live in the corneocytes. And what are the job of these molecular sponges, these hygroscopic molecules? To suck water up from the atmosphere, which is super cool when you think about it. So when you come to Colorado, where there's not a lot of ambient humidity, where there's ambient humidity is like 10% or 15 or 20%, from Miami, where the ambient humidity is 70% or 80% or even more, what's supposed to happen is you make more sponges. You make more hygroscopic molecules. You make more, by the way, the technical name for the hygroscopic molecules is, appropriately enough, the natural moisture factor. That's technically the name, the chemical name. And so when you come to Colorado from Miami, you're supposed to just make more natural moisture factor. That way you'll trap more ambient humidity. Make sense? So that's like a compensatory mechanism, an adaptive mechanism. But if you put a moisturizer, and I always have to do this when I go moisturizer because there's no such thing, moisturizer on your skin, you're going to prevent those molecules, those hygroscopic molecules, from absorbing moisture. Even more importantly, you're going to prevent the proliferation of more moisture factors. When you come to Colorado from Miami, you're supposed to just make more moisture factors. That's not going to happen if you put a so-called moisturizer on your skin. So between the skin, the collagen, the chemistry, the biochemistry, the enzymatic reactions, digestive benefits, blood benefits, which affects all the tissues of the body, neurotransmitter benefits, pain relieving benefits. You can see why drinking water is really important, and appetite suppression benefits and lowering blood sugar benefits. I mean, it's really incredible the importance and the relevance and the health benefits associated with just plain old H2O. The best kinds of water, as I said earlier, are going to be reverse osmosis, distilled, and if you get clean spring water, you know the water's clean, then spring water. The worst kind of water, and the kind of water nobody should be drinking, or at least avoiding as much as possible, is tap water, particularly tap water from other cities back east, which have old pipes in the water supply that leach things out into the water. And as far like copper, copper in particular is something that gets leached out into water. And then also last thing is there are allowable amounts of nasty material in your water, including human fecal material, that is allowed in the water, in the tap water. And if you go on to your city's website and look up the municipal water supply allowed levels of various particles, you'll be shocked at what's allowed in the water. And true, it's very trace amounts, but depending on how much water you're drinking, that's how much human fecal material and other things you're going to be ingesting. Oh, and then one more thing, fluoride and chlorine are a huge problem. And I'm not going to argue against chlorine. You know, obviously it kills, you know, germs that cause cholera and used to kill people many years ago. I don't even want to get into the fluoride fluoride thing. There are definitely problems associated with both. Some of the biggest problems are, and this is kind of interesting, chlorine makes toxins more toxic. So while chlorine kills living microbes, it can make toxic material much more toxic. And the toxicity associated with chlorine and the antimicrobial and antibacterial effects associated with chlorine can wreak havoc on the microbiome, and one has to wonder how much digestive health problems that people have, and some 80 million Americans have digestive health problems, are associated with chlorinated water killing off the microbiome. Aside from, of course, glyphosate. And oh yeah, if you're eating vegetables and fruits, you're probably getting chlorine and fluoride in the vegetables and the fruits because when they're grown, yes, they're using tap. They're not using distilled water to water your fruits and vegetables. They're using tap water from the city water, the municipal water supply. So if you're vegetarian, you may be getting a lot more chlorine and fluoride than non-vegetarians. Of course, you know, animals are drinking the tap water too. So we're pretty much, it's very difficult to avoid chlorine, and fluoride and all the other things in tap water because it's going to be in the food. Soda pop, fruit juice, produce, all that stuff is going to have tap water in it. So even if you are drinking distilled water and you're really careful about the water you're drinking, it's really hard to avoid getting water, municipal water or city water in your body because of the foods that we're eating or the beverages that we're drinking.
Okay, well, we've got lots of questions, and I do have one question.
Yes.
What do you think about hot tubs? And I
They're
know
awesome.
you can have them.
You know, I told you, vote for me. Vote for
I know
me.
we're gonna vote for you. Everybody gets a hot tub.
Hot tub in their backyard. Why? Hot tubs activate the parasympathetic nervous system. The best kind of you do have to obviously keep it clean. And the best way to keep your hot tub clean is by using light, UV light, or ozone also.
Okay, so using those chlorine tablets in your hot tub.
You're taking a chlorine bath. Oh yeah, and by the way,
Yeah.
while we're talking about chlorine, you know, everybody likes to jump in a nice cold pool in the summertime, but you know what? That's a chlorine bath you're taking. I remember when I was a kid, I don't like swimming pools. I haven't done that in a long time just because of the chlorine. But when I was a kid, I did, and I remember my eyes would be on fire when I came out of the pool, and it never dawned on me that because it was all the chlorine that I was, you know, I was a kid, I didn't realize it, but the redness of your eyes and the heat in your eyes is a reaction to the chlorine in the water.
Well, I appreciate that my gym has a saltwater pool.
Okay,
so
that's good.
They don't have a hot tub, but at least I can go swimming and not get a chlorine bath. Let's move right over to questions. And folks, again, if you were invited to this program by somebody specific and you have questions that don't get answered on the program, get back with the person that shared this program with you. So let's go to the first hand that is up. And I think Actually, Mary had her hand up first and then it got put down for a moment. So we're going to go to Mary, AJ.
Hi, Mary.
And Mary, go ahead and unmute yourself. What question do you have today?
Okay. Hello. Happy New Year.
Happy New
Pharmacist
Year.
Ben.
Hi, Mary.
Yes. Yes. Hi. We have a question from YouTube from Harry the Flying Angel in Sydney, Australia.
Okay.
How, he says, blessings. How do we help a person on a methadone program to better health? That's what we
Yeah.
have.
Well, methadone is an opiate. They use it's to wean people off of stronger opiates. The best thing you could do when you're on opiates and you're trying to wean yourself off of opiates is activate the parasympathetic nervous system. Withdrawal activates the sympathetic nervous system, and the famous withdrawal symptoms associated with opiates are really a manifestation of a major stress response. So activating the parasympathetic nervous system while you're, and I assume this is what they mean to try to wean people off of methadone. If Harry's referring to just how do you stay healthy with methadone, you just do the same thing that you do with anybody has to do. But I think he's talking about, I assume he's talking about weaning off of methadone. And the way you wean off of opiates is you make sure that you're relaxing the body as much as possible, even to the point of sitting in a warm bath the whole time. Warm water is the best and fastest way to activate the parasympathetic nervous system. Breathing, of course, is a great way to activate the parasympathetic nervous system. Touch activates the parasympathetic nervous system. Anything you do to activate the relaxation response, the vagal nerve, activate the vagus nerve, is going to support weaning off of opiates or really any kind of addictive substance. You know, when we go through and we're addicted to something, and this could be something as simple as food. And many, if not most people, have a certain food addiction or addicted to food. Notice that if you were to say to yourself, I'm not going to eat that Pop-Tart, I'm not going to eat that candy bar, I'm not going to eat that hamburger, whatever it is that we want to eat, or ice cream, whatever it is. Or if you're smoking cigarettes, you say, I'm not going to smoke that cigarette. Or if you're doing methadone or opiates or pills or whatever it is, you say, I'm not going to take those pills. For a little bit, when you say, I'm not going to eat that cigarette, and everybody out there listening to this program, try it yourself right now. Think of something you're addicted to. It could be as simple as food or something that you want. Notice that if you refuse to have that cigarette or pain pill or French fry, whatever it is, for a split second, it feels like you're dying. For a split second. Can you feel it? Think about a Pop-Tart or a French fry or cigarette or whatever it is you love, and then I'm not going to eat it. You feel how there's like a moment where it feels like your life is at stake. And that's why we get addicted, because we feel like biologically speaking, when the body doesn't get that addictive substance, it feels like it's dying. So what you have to do if you want to wean yourself off of any addictive substance is you've got to activate the relaxation response as soon as you feel the urge for that substance, because really the substance we're addicted to because it relieves the stress response. That's why we get addicted. Think about it. If you could just use your imagination right now, think about something you're addicted to. Notice that the idea of not having that substance activates the stress response. So when you have a cigarette or the opiate or whatever it is you're eating, that stress response drops. But if you can activate the relaxation response preemptively, that will support you weaning yourself off of the substance that you're using to deactivate the stress response. You preemptively deactivate the stress response with a more functional or healthy option, like breathing, like muscle relaxation, like massage, like therapeutic touch, whatever it is that you're using to activate the vagus nerve. Activate it preemptively so you don't need your addictive substance to turn on the relaxation response.
Perfect.
Okay, so for our friend in Australia,
yes.
think of it as a manifestation of the stress response, weaning yourself off of an opiate, which I assume you're talking about, and preemptively activate the relaxation response with all the wonderful vagal nerve, vagus nerve activating strategies we talk about.
Perfect. Sounds good. And even going to the beach could be another one as well.
Going to the beach is a great one. Absolutely. Having a vacation, massage, and just a zillion. Gratitude. I love gratitude as a an activator of the parasympathetic nervous system. Breathing is always the fastest way to affect your neurology, for better or worse. You want energy, do the breath of fire. And if you want to relax, do long exhalations and shorter inhalations.
Gotcha. Thank you so much. I'll turn it back over to Becca or the next person.
Hey,
We're
Becca.
going to go right. Hi. Well, we're going to go right over to AJ because we are coming short up on time. AJ.
AJ.
Pharmacist Ben, how are you, sir?
I'm good. Nice to see you.
Great to see you. I have a couple of questions here. My first question to you is, when you were young and in that pool, were you the kid with the different color ring around you in the pool?
Oh, my word.
Different. You mean the yellow ring? Is that what you're talking
It
about?
was, it was always the kid that had a different color ring.
No,
Yeah.
I did. That was not me.
No, it wasn't.
No.
It wasn't on any of us. So the question that I have from our good friend is, I'm so sorry, Becca. Here it is. I'm going to start with the first question. Can insulin resistance cause the body to produce more DHT? How can we just stop the production of DHT apart from topicals? I mean DHT buildup on the scalp.
How can we lower DHT on the scalp?
And can insulin resistance cause the body to produce it?
Absolutely. Insulin resistance leads to high insulin levels, and insulin is definitely associated with an increase in DHT, which can lead to hair loss and acne and prostate problems, a whole bunch of health challenges. So yes, absolutely. Insulin and insulin resistance can both be associated with increases in DHT. Just for the listeners, testosterone can get broken down into two different ways. The breakdown of steroid hormones is very important because steroid hormones are extremely powerful. So the body breaks down steroid hormones, particularly the ones at the bottom. Remember, I think we showed that how steroid hormones are made. Did we ever do that?
That was awesome. I think we did that on a Monday, though.
Oh, we might have done that on Monday. Okay. So steroid hormones all start off with cholesterol, and then they work their way down through DHEA and pregnenolone and progesterone and androstenedione. And then at the bottom is where you have your most toxic, or let's say most powerful steroid hormones, which are testosterone and estrogen. Estrogen is the very bottom, which makes it the most powerful and potent of all the steroid hormones, or I say it makes it the most powerful. It's associated with its potency is the fact that it's way down on the bottom of the steroid production or steroid synthesis of pathway, steroid synthesis pathway. That makes sense how I said that? Starts off with cholesterol and gets shape-shifted through a bunch of stuff until you get to testosterone and estrogen. Testosterone is right on top of estrogen. Telling you that testosterone gets turned into estrogen, and this is one of the reasons why bodybuilders and athletes who abuse steroid hormones can end up with feminine characteristics, and they're very paranoid about that. Obviously, if you're a bodybuilder or you're an athlete, the last thing you want to do is have breasts and small, male sexual male organs. So the testosterone also gets turned into DHT. So testosterone can get turned into DHT and it can get turned into estrogen, one or the other. Those are the ways testosterone gets broken down. So if you want to prevent testosterone from forming DHT, there are nutrients that you can take that can stop that from happening. Zinc is probably the most important. These are DHT inhibitors, they call them. Essential fatty acids, particularly omega-3 fats, can be DHT inhibitors. There's a herb called chrysin, another one called tribulus that are DHT inhibitors. And these are all strategies that you can use to reduce the breakdown of testosterone into dihydrotestosterone, which can be thought of as super testosterone. Now, DHT is important, but you just don't want to have a whole bunch of it because of its very powerful testosteronic effects, which can lead to things like male pattern baldness and prostate disease and acne, as this patient or as this questioner asks. So if you don't want to make DHT, use DHT inhibitors. DHT inhibitors, zinc is probably the most important one, but omega-3 fats. I think GLA might be a DHT inhibitor, and then chrysin and tribulus are two herbs that have DHT inhibition properties.
Can't just wash it out of your hair.
Yeah, and then wash it out of your hair, exactly.
Oh, you can. Okay. So
Yes.
now,
What do you mean wash? You can wash. What do you mean? Wash what out of your hair? The DHT?
yes,
No, you're not going to wash DHT out of your hair, but you can wash the DHT inhibitors out of your hair.
the zinc and the.
Yes,
So
if you're using
so
them.
you're saying you can use them topically
Yes.
and
Green-
internally.
Say that again.
And in addition to internally, you can use these inhibitors topically.
You should. Yeah. No, topically, you're not going to get great benefits from them, but internally, yes. You should be using them internally. The
Okay.
enzyme. There's an enzyme that's associated with the conversion of testosterone into DHT. It's called 5-alpha reductase, or 5-AR, and this 5-AR, 5-alpha reductase enzyme is a target for things like Propecia, which you may have heard of. It's a hair medicine or baldness medicine, and also Proscar. In fact, Proscar and which is for the prostate, and Propecia are actually the same drug. They're finasteride. They're both the same thing, and they're both DHT inhibitors. But you can use natural DHT inhibitors to get similar benefits. Like I say, zinc, pumpkin seed oil, green tea, chrysin, tribulus. These are all 5-alpha reductase inhibitors, or DHT.
How does transition into perimenopause and then into menopause and later into postmenopause impact on production of DHT?
That you're starting to get to steroid hormones. Probably, I would guess. I don't know the answer to that actually, but probably I would guess that during menopause, you're making more. I don't know the answer to that. I don't know how that would help, but how that would affect menopause itself wouldn't have an effect. But the insulin resistance and the biochemical disturbances that are associated with menopause may lead to more DHT, and this is one of the reasons why menopausal women will end up with masculine characteristics, such as hair loss, for example, or aggressive behavior, maybe. It's interesting. As men get older, they become more feminine, and as women get older, they become more masculine. And a lot of that has to do with DHT, and a lot of that has to do with not the natural conversion, or I should say normal conversion of testosterone to DHT, but conversion of testosterone to DHT following excess insulin or insulin resistance. And really, insulin resistance is associated with a lot of the problems that we consider to be just normal when it comes to menopause. So if you can deal with your insulin resistance issues, if you can prevent insulin resistance and you're in menopause, you're less likely to have menopausal symptoms, and that includes elevated DHT, which may cause hair loss, oily skin, acne, hirsutism, hairy hair on the body. All of these can be linked to excess DHT, which follows insulin resistance that many menopausal women deal with.
What can help reduce lung nodules, either benign or malignant?
Okay, so let me ask you this. What would cause a lung nodule? What would cause a nodule? What is a nodule? It's
a nodule is a growth.
Right. What would cause things to grow?
The growth would be an insulin imbalance.
And estrogen. The two major growth substances in the body are insulin and estrogen. So if somebody has nodules in the lungs, that could be a couple of things. First, it could be insulin resistance. And let me backtrack real quick. Where you see the problem is not where the problem is, right?
Yes, sir.
The fruit, not the root. Our medical models, and by extension, because we are all kind of an extension of the medical model, but in terms of our beliefs and in terms of what we think is right for the body, will focus on the fruit, the nodule. The nodule's not the problem. The nodule, the growth, can be due to a lot of things. It could be due to insulin, which is a growth substance, estrogen, which is a growth substance, or it could be chronic irritation in the lungs. So if you have chronic irritation, you're a cigarette smoker, for example, that can also lead to growths. So nodules are a sign that there's some kind of disturbances in the biochemistry of the body. They're not, the problem is not you're not going to affect the nodule by trying to deal with the nodule. You got to go upstream. Now, nodules in the thyroid can be a sign, and that's somewhat common. That could be a sign that the thyroid is trying to grab nutrients out of the blood. And that could be a sign of low iodine levels, particularly if you're not eating seafood. If you live in the middle part of the country where there's not a lot of seafood, iodine is an ocean mineral more than a terrestrial mineral element. And if you're dealing with iodine deficiency, you may get thyroid nodules. But for the most part, I think of nodules as a sign of growth, excess growth, estrogen and insulin. And there is overlap between insulin and testosterone too.
So dysbiosis, you got to deal with that first.
Always. And there, dysbiosis also affects estrogen. There are bacteria in the intestine that process estrogen. When those bacteria, when you have the wrong bacteria or too much bacteria in the small intestine, what can happen is instead of estrogen getting eliminated, estrogen can get potentized. And this accounts for a lot of estrogenic health problems, including cancers, estrogen-dependent cancers. So the microbiome definitely plays a role in how the body handles steroid hormones, particularly estrogen.
All right. Thank you so much. Lots of questions there. And for those of you who do not know what DHT, that is dihydrotestosterone. So
yes,
next question. Nancy wants to know, or she has said, is there truth, because she has heard that distilled water causes a flushing of medication and supplements?
Yes. Distilled water will clean things out more effectively. That is true. It will cause nutrients, not so much nutrients, but drugs. Because there's not a lot of stuff in distilled water, it's like a vacuum. It does pull out things that are like it's a better way to detoxify medication, but you can't depend on it as a detoxifying substance. But yes, you will clean out. You'll clean things out more effectively with distilled water. Now, one thing about distilled water that you hear sometimes people say is it'll leach minerals from your bones. Have you ever heard of that? That's not a thing. But
we hear that a lot these days.
It's not a thing. And anybody who says that doesn't understand chemistry. That's not a thing. However, it will clear out supplements and drugs more effectively. That is true.
Okay. Next, let's go over to Jill. Jill, go ahead and unmute yourself. This is Jill M.
Hello there, Pharmacist Ben. So just to follow up to what you just said there, it's okay, though, to mix up your healthy beverages with the distilled water, yes or no?
Yes, you should.
Okay.
Absolutely.
All right. I thought so, but then I was looking.
Because it'll go into the water more effectively.
Oh, effectively, not ineffectively. Oh, okay. Got it. Thank you. So I have a mom who reached out to me with ideas on how to detox and for her daughter. And her daughter's 32 years old. And then we got into all the different things that is wrong with her daughter. And I just wanted to get your thoughts on what the direction would be to go. She's 32. She has severe swollen veins internally close to the uterus and is slated for an operation where they want to go in and put some kind of coils to bring down the swelling. And of course, I'm asking for holistic things to support whatever her doctor's doing.
What is causing the swelling, did they say?
No, but let me finish reading and then maybe that'll give you a little insight.
Okay.
They want to put some coils in to bring down the swelling causing so much pain. She also recently had surgery for gallbladder removed that apparently was so dead but spewing poisons into her for many years. Doctors could not figure that out.
This woman's 32 years old?
Yep.
Holy
Okay,
cow.
it gets worse. She had 2 COVID vaccines, and since then she has heart problems like rapid beats, heartbeats, which she's also being monitored for. And it sounds like one of her kidneys is severely swollen, and she's waiting for test results on that also, and it's very painful.
She has a serious blood problem. And that makes perfect sense if she was injected.
Mm-hmm.
And that's the thing. And they're actually now starting to find that out, which we talked about here for years. You can't stick things and you can't put things in the blood and not to expect something to happen. So venous swelling is a sign that the blood's not circulating correctly. The heart problems, those are signs that the blood's not circulating correctly. It's a blood issue that she has. Now, she had a gallbladder taken out. So the chances are pretty good that she's dealing with blood toxicity from the intestine too. So, and the fact that she's 32 years old is good and bad. The fact that she's 32 years old and dealing with all this stuff, that means she's in trouble. But the fact that she's 32 years old also means that she can recover quickly. So it's good in the sense that she's young and she can recover. It's bad in the sense that she's very progressed. So she really wants to do something quickly. I would be working on food first of all. She probably has long-standing food problems, and that would account for.
I don't know that, but I would certainly think that's the case. And I was planning on going there as somebody who also doesn't have her gallbladder, understanding that she likely has food issues.
Yeah, why would they have taken the gallbladder out at the age of 32? It's pretty dramatic to take the gallbladder out. And listen, as much as angry as it makes me when I hear that, physicians yanking out organs like that, it's up to us to understand that our organs are all important, and you don't take an organ out unless there's cancer and you don't have any other options. But to take a gallbladder out because you have gallstones, it's lazy, sloppy medicine.
I don't know if that's what happened with her. That is what happened with me. I mean, I certainly didn't need to have mine out in retrospect, but they're feeling like hers was very diseased and was, was poisoning her body.
If she has, well, it could have been because everything's backed up.
Yeah, right.
The bile is part of the blood.
Right.
It's an extension of the blood. So she's dealing with dirty blood issues from leaky gut, which is probably, that's what it sounds like to me. I'd be working on her digestive system. Then that can definitely cause a problem with the gallbladder spewing poison out into the bloodstream. But that's not a reason to take out the gallbladder. You need your gallbladder.
Right. So thoughts on the vein issue?
The vein issue is because of the dirty blood. The blood's not circulating.
Right.
The blood doesn't go up. The circulatory system is a circle. Obviously, it's called the circulatory system. It comes from the heart and then it goes back up around. If the blood is sticky and sludgy, it's not going to make it on the return trip very effectively, and it's going to pool down to the bottom, and that can cause the veins to become swollen.
Okay. And then even the same thing with the kidneys, right? Her filters in her kidneys.
Absolutely. Same thing with the kidneys. So if the blood pools because it's not moving correctly, you can definitely end up with venous swelling, edema, they call it, varicose veins, hemorrhoids. All those can be associated with or valve issues, clots. There's something called DVT. I don't know if you ever heard of that, which is clots. She's prone to all of that stuff.
Yeah,
with venous swelling.
I initially started talking to her mom about nightly essence for the nattokinase in it. I don't know if she's on a blood thinner.
She might want to use bromelain. Nattokinase is good. So is bromelain. Yeah. Her strategy should involve eliminating or reducing the toxicity that gets into the blood that causes it to sludge up, and then fluidizing or liquefying the blood with fluid, with water, deep breathing, glucosamine, fucoidin, hyaluronic acid, anything you could do to improve blood glucose. I said glucosamine. Anything to improve the fluidity of the blood. She's a blood problem, and the injection didn't help. I don't know if it's the cause of everything, but it certainly didn't help.
Okay, great. Got it.
All right.
And of course, the Healthy Brain and Heart Pack.
Yeah, Healthy Brain and Heart Pack. Yes.
All right. Thank you, Ben.
Thank you.
All right. Thank you, Jill. And 2 more questions, Pharmacist Ben. Olga out on YouTube. She says, she keeps trying to explain to some elderly folks while they keep saying, I don't feel thirsty. I think the age people don't feel thirsty that much.
Yeah.
Well, already being dehydrated.
I notice myself that older people don't feel thirsty as often. I have noticed that. And I think age has something to do with that. I'm not sure exactly what it is, but yeah, I have noticed that too. You have to with your older, it becomes extra important that you drink. One of the things, and it's very noticeable, one of the things that happens as we get older is we dry out. We dry out everywhere. Everywhere we dry out, and you can see it visibly. So it's not just the water, as we said, but yes, water plays a big role, but it's also the connective tissue. So using structuring elements, particularly minerals, proteoglycans, hyaluronic acid, fucoidin, glucogel, those are all made with substances that can trap water in the blood, and then also just plain drinking water. Building connective tissue using structuring elements like ions and proteoglycans, and then drinking water. Yes.
All right. And Marilyn, what question are you bringing in for us today?
Okay. Hi, Ben.
Hi.
When I think of cognitive decline, is it possible when someone gets numbness in their hands that that's an issue? Because I think of the homunculus,
Homunculus.
yes, with the
What's
big
the
hands.
Yeah.
And that's for the
So
brain.
yeah. So you're saying the hands and the feet, which are outsized in the brain. You're saying.
Right.
So what's your question? I didn't quite
Okay,
understand the
well, I
question.
have a client that has numbness in their hands. Could it be an indication of brain decline?
It could, they could be associated, but really numbness in the hand should be more regarded as a nerve issue, which can be either a pinched nerve, which sometimes happens if you're holding your body weird, or it could also be circulatory problem. So you want to make sure that your heart and your cardiovascular system is working effectively. And then if it's your heart, if it's not a circulatory problem, you might want to get body work to correct the pinched nerves. There's also really interesting exercises. I don't know if you've ever seen these. They call them flossing exercises. Go like this kind of, and those can loosen pinched nerves too. So for people who get numbness at night. Sometimes people get numbness at night if they sleep in a weird way.
Okay, there's been some people that have been taking these like neural spin balls that they hold in their hands. Can that help?
That I don't know what those are. I've never heard of those.
They like a lot of movement and light stimulation to the hands. I was just thinking because of the homunculus, because is it stimulating like more activity in the hands that could help maybe, or no, just what you said?
I'm not really understanding your question. So you're saying, can working with your brain help stimulate, can help
working
improve
with
dumbness?
your hands, more strength and more pressure, and work with the hands actually stimulate
Your brain. Oh, heck yeah. Hand-eye coordination, of course. Absolutely. Not necessarily muscle, although that might work too. More like coordination. Working with coordination kinds of things. Yes, absolutely. That can help your brain. And that is a great exercise for older folks to do.
Yeah, for like brain fitness.
Yeah, brain fitness, actually. Yeah. And if I don't know if Jill's on, she knows much more about this than I do, but that's her expertise. But yes, working with your body can definitely help the mind. There's more connections going from your brain, from your body to your brain than your brain to your body. So your brain is constantly responsive and reading what's going on in the body. And you can improve brain health by movement. That's what Jill talks about, actually, is brain fitness, improving brain fitness. I don't want to speak for her, but improving brain fitness by using the body. In other words, the soma can help the psyche. Yes.
Jill does say hands activate the brain in a big way.
Yeah.
And yes, there's lots of connectivity between the brain and hands.
Yeah, that's the whole brain fitness, as I understand it. I might be wrong, but I think that's the whole premise of brain fitness, is by moving the body in certain ways, you improve the brain, the health of the brain, the fitness of the brain.
Exactly. And that's one thing she had mentioned on our show with us Wednesday. It says, use the body you have to get the brain you want. Yeah. Just like you said. You've been listening. Good job, Pharmacist Ben.
All right.
Hey, AJ, one last question, and then he might have to jump.
I know he's got to
jump. I'm late.
I know he's got to go. But what B vitamins are going to be helpful for this nerve activity? And can you find them in Tangy Tangerine?
Absolutely. All the B vitamins are going to help, particularly vitamin B1, whose claim to fame is it's used for neuropathies and for it was actually, I know I've told the story before. I don't want to tell it again. I've told it so many times, but
I love the story.
It's a good story. Yeah. So thiamine was discovered as a cure or as a treatment for reversing neuropathy. So thiamine, and I find thiamine to be incredibly underutilized and underappreciated medicinally. And thiamine is found, you're right, in the Beyond Tangy Tangerine. B6 also plays a very important role in neurology, and so does B12. And so does niacin, B3. But I don't like thinking of like the individual Bs. The whole entire B complex is what you want to think about for the nerves.
Pharmacist Ben, before Becca lets you go, through our society, we've had all these products that are called the thirst quencher, and we got the dry mouth stuff, and certain beers are supposed to be to quench your thirst, and sodas to quench your thirst. Okay. What do you
to quench my thirst?
Is the best thirst quencher?
I find water or tea, iced tea, to be the best thirst quencher for me. And lemonade or lemon water.
And how do you
And is your
sweeten
ice
this thing?
Say again? What was the question?
How do you
Rebecca?
sweeten your beverages?
I use honey. Sometimes I'll use stevia, but mostly honey.
Doesn't tea have caffeine where it'd be dehydrating?
That's why I say decaf tea, low
Oh.
caffeine tea, or green
I
tea.
was gonna ask black tea, green tea,
Green
white
tea.
tea,
Green tea is the
herbal
best.
tea.
Green tea is the best.
All right. Well, thank you so much, Pharmacist Ben.
right.
If I could
Thank
get
you,
the
everybody.
co-hosts up with
9
us.
o'clock Monday?
9. Oh no, no, I'm not on this Monday or Friday. I'm going to be out of town. Sorry. Thought I told
We're
you.
gonna
My
miss you
whole
next week.
world is shattered.
Oh. All right, guys. Bye.
All
Thanks,
right.
Pharmacist Ben. Have
Thank
fun.
you so much. Have safe travels. And folks, thank you so much for joining us here on Daily with Doc and Becca. I just want to do a shout out, as I am so thankful that I do not have to do this show without my co-hosts, as they're letting people in, keeping an eye on the chat, bringing in questions, putting in notes into the chat. It's just not something that I wouldn't want to do by myself. So thank you, Marilyn, for all that you do. Phyllis, Albert, Mary, AJ, you just make my job so much easier, and I greatly appreciate it. And we hope every one of you have a fantastic day, a fantastic weekend. And again, get back with the person that shared this program with you. If there is no one to thank and you have not been working with somebody already, we do have a team of people on our call team at 855-949-3377. All of them certified holistic health coaches that have gone through the coaching program from the Institute of Holistic Health, where they learned about the 4 areas of health, but beyond the soft tissue, the hard tissue, the blood sugar, and digestion, and going into the 8 holistic areas of health in the holistic will. If you'd like more information about that program, this is open to anybody and everybody. Go to coach.dailywithdoc.com. Again, coach, COACH.dailywithdoc.com. Or you can also call the call team, 855-949-3377, and they can help answer questions and get you enrolled as well. So until next time, thank you everybody for joining us here on Daily with Doc. My name is Becca Dukes, and I am so honored to be able to provide this resource to you, putting tools in your toolbox to help you become more empowered and in control of your own health and wellness. So until next time, join us. Check us out, dailywithdoc.com. And you want to see some of our past episodes, you can always go to, just do a search, favorite search engine, Daily with Doc and Becca. You're going to come up on YouTube and Twitter, X, Instagram, Facebook. We are just flooding the waves and the World Wide Web with information that is easy and you can implement yourself. Until next time, bye for now. And thank you for all the amazing comments. Thank you, thank you, thank you, Nancy and Nancy and Nancy. We had lots of Nancys. We've got Bruce and Monique. It's absolutely fantastic. We love you all. Have a blessed day. Bye for now.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach.